Greetings, Dr. Dalton. This is Jesse McCoy here, and I will be providing my weekly feedback in reference to the assignment of emerging or future conditions affecting persons with disabilities. So I'm going to discuss the three that I thought. I read the information that you provided in reference to all the different articles and disabilities, but after examining these, I thought that the ones that I selected is going to be kind of crucial because you got to get past, you got to get over the hump to get to what the things that you have provided in reference to those particular disabilities. So I selected behavioral issues, also selected life care planning, as well as a shortage of healthcare providers. That is certainly going to impact the rehabilitation world in the future by we having a shortage of healthcare providers. So let's move on to the behavior issues. So besides healthcare funding, we all know that healthcare funding issues, they are major issues. They're going to be with us for a while. But behavior issue will most likely be the number one health and rehabilitation issue around the world. That's because behavior issues will no longer be on the back burner. One out of five adults experience mental health illnesses every year, costing over $440 billion annually. Behavior issues emerging daily in all forms and fashions. Mental health professionals have their work cut out now and into the future. There will be way too many behaviors, ranging from addiction, if you will, to lack of weight control. And as rehabilitation counselors, we have to be ready for any client and their issue that comes to the door needing help. And as people in the world become more diverse, their behaviors are presented in a more dynamic way, causing a ripple effect and how they are to be helped. And so, based off of the therapeutic approaches that we have, people are they are more diverse. They come in more, with the more dynamic issues. We certainly, and I foresee blended therapeutic approaches for their therapy treatments. As we talk about life care planning, definitely an issue. Not only an issue for people with disabilities, but an issue for everybody. All right, but probably more so due to quality of life for people with disabilities. So life care planning is crucial for the future. Life care planning includes detailed planning in terms of current needs versus future needs, estimating the cost of living with a particular disability, including services, equipment, home modifications, living arrangements. This information came out of our text, Marina, 2012. So everybody need to perform a life care planning. So this area of care is not intended or if not intended, will spill into the rehabilitation arena, adding workload to the already existing workload, life care planning. So the demand for rehabilitation counselors is expected to grow with the increase of the elderly population and with the continuation of rehabilitation needs of other groups such as veterans, people with disabilities. We have that increased awareness. Definitely needs to be done in the area of public service announcements to continually reach people until life care planning has taken root and has become an importance. So I looked up little statistics for rehabilitation counselors, and I do see that there was an estimate around 120,000 rehabilitation counselors as of 2014. However, in 2024, year 2024, we're gonna need about 140,000. So certainly an increase. Now we move on to shortage of healthcare providers. Shortage of healthcare providers. We have a lot of people in the world. A lot of people in the United States. I think we're approaching 328 million people. So definitely a lot. And so right now they're estimating by year 2020 that we're going to face a shortage of about 90,000 physicians. So my take on this is where everybody's going to go who needs help. Help with mental, help with the physical. Where are they going to go? Well, we have a shortage of healthcare providers. The next step is, hey, we're going to send them to some type of counseling, whether it be rehabilitation, occupational, those type of therapies. And so it is anticipated that there will be a shortage of healthcare providers. So by 2020, the United States will face a shortage of about 90,000 physicians, according to Association of American Medical Colleges. Industry experts say there are three causes behind the shortage. All right, with additional shortfalls expected as a result of reform. So you got population growth, longer lifespans, and aging Americans all call for higher demand of medical professions. Now, this particular one didn't include people with disabilities, but you know that is definitely a part of the number. So over the next decade, the Census Bureau projects a 36% of growth in the number of Americans over the age of 65. Over the age of 65. And that is the Patient Protection and Affordability Act care will expand coverage to more than 30 million Americans in the next decade, all depending on the current presidential administration. And so that is an additional 80,000 primary care physicians needed in 2025 to treat patients obtaining a coverage under the Patient Protection and Affordable Care Act. According to the studies, that's going to raise up somewhere in the neighborhood. We're looking at around the world now, primary care visits, or I should say in the U.S., primary care visits 565 million by 2025. So, yep, it is a great anticipation. Where everybody going to go? Rehabilitation counseling, occupational counseling, physical therapy. That's where they're going to go. I did have some other areas. Funding, we know funding is definitely always going to be at the top. Another area I would like to see improve is accommodations. You know, accommodations not in place, it's definitely going to hamper and challenge people with disabilities, especially in the workplaces, participating in events and activities, say around in the city or whatever. Let's see what else I have. Okay, we definitely want to watch job opportunities for people with disabilities. So conducting those skill inventories of what an individual can and cannot do is essential. Knowledge, skills, and ability must remain the center focus of the job. So people with disabilities have knowledge, skills, and ability that are highly rated. And with the use of accommodations can turn an upside down business right side up, producing, greater outcomes, for the business to succeed. So definitely job opportunities. And we definitely have to consider people with disabilities. And we know we have a lot of smart people out there. So don't let the disability fool you. We also know about education opportunities for people with disability, enhancing education, overall college experience, and with counseling will assist, students with disabilities. We know about that. And then we get back to the veterans' mental health. We definitely have to watch that. One key issue that needs to be addressed is the overwhelming number of veterans whose mental health needs are not being serviced. So the VA is conducting more hiring programs such as peer specialists and coach to care. These type of programs were put in place to assist veterans to regain their lives. So the VA has authority to appoint peer specialists. Peer specialist is a veteran who has recovered or is recovering from mental health condition and is certified to provide peer support services. All right, moving on to coaching into care is a national telephone service of which the VA aims to educate, support, and empower family members and friends who are seeking care and services for veterans. So we got some out there for those people as well. And last but not least, I do want to place concern on our deploying service members. We definitely need to watch this very closely. So society issues are absorbing service members beyond the war. For many service members, they do not spend enough time at home to recuperate psychologically or physically. Therefore, when they return from places like Iraq and Afghanistan, their mental health and physical health is already compromised. So, action performed while deployed without breaks take a toll on service members' health. All right, but many service members are taking their lives, right, for things beyond war. And so we do have a lot of soldiers losing their lives to suicide. So in the VA, we have several objectives. We have about 5 main objectives, but 3 of them are on the top of the list. So one of them is access to care. Another one is help prevent suicide, and the other one is homeless. So as you can see, by me working in the VA, have that inside information, but it's also relevant for the class. I'd like to thank everybody. This concludes my video overview for discussion number 8. I am Jesse McCoy, and y'all have a great week. And also, thank you for being part of this class. We appreciate you, and you take care.